Good morning. My name is Paula Jones, and I am the Director of the Health Careers Program with South Carolina AHEC. On behalf of South Carolina AHEC, we would like to welcome you to the 2022 Bench to Bedside Spring Symposium. We're doing this in collaboration with Low Country and Mid-Carolina AHEC, Aiken, Denmark, and Orangeburg Calhoun Technical Colleges. Bench to Bedside strives to prepare students in South Carolina for successful application to health professions training programs. We work with students from the high school, technical, baccalaureate, and graduate levels. We are excited today to give you an opportunity to listen to 4 professionals talking about their careers. At the conclusion of each speaker, you will have a chance to ask questions. The speakers will also share their contact information in the event that we run out of time or if you have additional questions. Again, welcome to the symposium, and we encourage you to take advantage of this opportunity to gain insightful information about the careers we will explore. Now, I will turn it over to Jalacy Green and Whitney Rojas, Low Country and Mid-Carolina AHEC Health Careers Coordinators.
Good morning, everyone, and thank you once again for logging on to the 2022 Bench to Bedside 2.0 Health Symposium. We are going to get started in just a second with our first panelist, Professor Jackson. She's a nursing instructor at Denmark Technical College. But before we do so, I please ask you that you keep your mics muted throughout the duration of each presenter. And if you have any questions, please type them up in the chat box and submit them before the panelist is finished with their presentation. We will answer as many questions as we can within the time frame that we have for each Q&A session. But once again, the panelist information will be shared with you if you have any additional questions following the panel. Again, my name is Whitney Rojas, and I'm the Health Careers Program Coordinator for Mid-Carolina AHEC. And my partner in the symposium, Jalacy Green, she is the Low Country Health Careers Program Coordinator. She'll unmute herself for a second so y'all can see your face.
Hello, everyone. I'm Jalacy Green, ACP Coordinator for Low Country Area Health Education Center.
All right, and we are going to begin our panel once again with Professor Jackson. She is a nursing instructor at Denmark Technical College. So we're going to turn it to you.
Good morning, everyone. As they mentioned, I'm Adrienne Jackson. I'm a nursing instructor at Denmark Technical College. I've been in the nursing field for about 10 years. I have worked in various areas. I accidentally fell into the field of nursing. I've actually grew up wanting to be an MD. Got placed on a waiting list, and then ran into a dean of nursing on an elevator one day in school. And that's how I fell into the world of nursing. When we think about the definition of nursing, I like to give this definition because it gives the whole view. Not only does the nurse come in and provide direct patient care to the patients and follow through those orders given by the MD, they also are there to give the patient complete holistic care, okay? So not only the physical, they're handling the mental as well as helping these patients get back to their baseline. And the number one thing I always tell my students, make sure you always be your patient's advocate, and the doctor is, and also be open to working completely with the team. Okay, there's a few levels of nursing. You have certified nursing assistants, which I always tell my students, definitely work well with your certified nursing assistants. They're in the room a little more than you. And you all are working all on the same team to complete one goal, and that's to provide great patient care. Your next level of nursing is licensed practical nurse and registered nurse. A registered nurse could have an ADN, which is an associate's degree in nursing, or a BSN, which is a bachelor's of nursing. You also have the advanced practice nurse, and those are your nurse practitioners. The nurse practitioners go in and they provide primary care. They also participate in, specialize in different specialties, sometimes the OR, oncology. There's various areas that the MP is being utilized in instead of primary care. So how do I become a nurse? One, you want to make sure you find the right school, a nursing program that fits you. Some of them have fast track programs. Others, it may be 2 or 4 year, whichever one you feel like is best for you financially and academically. You also have placement tests. Sometimes they'll take the Kaplan interest test, which is called the TEAS test. Here you must score 60% or higher. Okay, you also attend a nursing information session that gives you the background of what your nursing life would be like as a nursing student. They'll also do a criminal background check, drug screening, PPD, and things of that nature. When you complete your education on either one of those levels, the nurse has to sit for board examinations. And the National Council Licensure examination is for practical nursing, which is the licensed practical nurse, and the registered nurse. And remember, I said you can get an ADN or a BSN in there. For the advanced practice nurses, they will take a certification exam that is developed by the Accreditation Board of Specialty Nursing Certifications. So it's very detailed. You have a wide range of things you could do as a nurse, which is one of the pros. Having job security, it's a trusted profession, and the flexibility of it all. I think that was my main reason for staying in nursing for so long, and I haven't taken the step to becoming an MD because nursing leaves me it leaves open the opportunity for me to practice in multiple areas and get a wide base of knowledge as far as medicine. Also, some of the cons, of course, the long hours. You are usually standing up on your feet from anywhere to 12 to 16 hours. Now, with everything that's going on, they have taken that into consideration since the pandemic. I noticed some people are integrating 8 to 10 hour shifts, which is good. Because of those long shifts, it's a lot of physical demand on the body. So decreasing the hours could definitely help, and adjusting your workload. So during those 12 to 16 hours, you may have anywhere from 6 to 10 patients under your care, and in a long-term care facility, you may even have 20 or more under your care. Difficulty of the nursing program. I talk to my students all the time about the difficulty of the program, because nursing is, although we make pretty good money, it's not a field where you should go in it for the money. You really have to have a love for helping people and a love for the field. So the program is very difficult, but if you're focused on your dream of becoming a nurse, then the difficulty won't even bother you. So a regular day in nursing, you'll come in very early. Most nursing shifts start at about 6:30 a.m. You'll come in, you'll do your shift report, which sometimes they'll do a huddle. You'll come in, you'll do your huddle, you'll get your report on the patients as far as the unit, how well the unit is functioning, how sick are these patients. And that will be their acuity number and their acuity level that will be given during that huddle. Also, once you've done that huddle, you'll go around with the nurse that's giving you report, okay? And then from there, you can kind of organize your day. I try to teach my students to set it up, be really good at time management, organize your day, because you're going to have a list of tasks, but that's per patient. Okay. So I always try to encourage them to get into those management skills early. Here is a list of areas of nursing: medical, surgical, critical care. That'd be containing your ICU, ER, or trauma ICU, oncology, hematology. Legal nurse consulting is new to the area, is a new area of nursing. Not too new. I think it's about, you see a lot more nurses doing it now, but I think it's been around since the late 80s, early 90s. With the legal nurse consultants, that's your prudent nurse, as we would say. And that nurse will come in and she'll make sure that nurses are following particular protocol, and she'll be called in for a witness for certain cases. So some common tips that I've always given my students and new grads that I work with, I always tell them to be a lifelong learner. Medicine changes over time. Science changes over time. We have to learn all the time. Things change, so you have to be open to that change. Okay. I have been a nurse close to 10 years, and I can tell you now I run into things I've never seen before. But because I still have that excitement about learning, I'm like, okay, let's go ahead. Let's try it out. Let me research it. I love to read. I always encourage them to be an avid reader. Sometimes you may not be familiar with the procedure you're walking in on, but there's always some type of nursing manual or instructional manual that you can refer to, as well as just looking up on those basic procedures on a unit that you'll be working for. Always evaluate your mental health. Nursing is hard. It's probably the hardest job I've ever had in life. Okay. And I always tell them it's a lot of pressure. It's a lot of long hours. You're going to see a lot of terrible things happen in front of you, as well as dealing with the grief of losing a patient. Well, if your nurse is if their mental health is stable, and that means taking a break, simple things, making sure you're taking your days off. Okay. And the main thing we're seeing now is nurse burnout. And I always tell them, if you're feeling that exhausted, or you feel like you're gonna get to that point, don't wait to get burnout. Go ahead and take you a mental break. Discuss that with management. Some facilities are now implementing those mental health practices, but I try to make sure that I educate my students, as well as nurses that I train out in the field, that mental health is important, and always evaluate yours as a nurse. Critical thinking is key. Number one thing, be able to connect the dots. Okay, it can make or break the decision you'll make to save that patient's life, or changing just their outcome. Okay, so critical thinking is key, making sure they understand and learning to connect the dots. Okay. As far as the future of healthcare, and I'll just speak on it for a few. Since the pandemic, the healthcare has started to evolve more so in the telemedicine way, because we had that break where we couldn't take on patients in person. That's the number one thing I talk to my students about, and being able to utilize your resources around you. And I believe that's it for me. Guys have any questions for me? I hope I didn't run through it too fast.
No, you were good. There are a couple of questions that we have off on the side. So you mentioned time management and always being eager to learn new things. What other skill sets other than the standard medical skills do you think that nurses need to be successful?
The critical thinking piece is definitely one. And what I mean by that is, a lot of time, the students will come in and they'll be fine with obtaining the information, but understanding how to apply it becomes a brick wall. So that critical thinking piece, just practicing on simple things. You can play brain games to help you with that critical thinking. Also, there's a method I utilize with my students, concept mapping. that helps them kind of bring all the information together because there's so much for them to see. So I think critical thinking would be the best piece besides time management to work on.
And then another question. I don't think we covered what encouraged you to go into nursing.
Well, as I mentioned earlier, I've always actually wanted to be a doctor, a trauma surgeon at that. And I didn't get into medical school, so I was placed on a waiting list. And at the university I was at doing research at the time because I was a microbiologist before I started my nursing career. So nursing is the second career for me. I was working on a research project and I ran into a dean of nursing. I didn't know she was the dean of nursing. I just happened to have a regular conversation with her on the elevator. And she asked me what my next step were. And I told her I wasn't sure because, I just found out that I didn't get into medical school. She said, I think you'll be a great nurse. Come by my office and see me. So I went by, I met with her, applied, got in, and the rest is history.
All right. And do you have any additional tips or helpful hints that will help these students out in the future?
I'll leave them with this. I would say to all the students that are thinking about nursing, to not be afraid of failure. You're going to be tested a lot in the nursing field, whether it's on your skills or just exams in general. And not everything you'll be successful on the first time. But the important thing is to actually get the skill down pat and understand it and be able to critically think when you're in the field. So forgive yourself if you do fail and be prepared to move on to the next phase.
That is some really good advice. Thank you once again for taking time out of your day to speak with the students.
Oh, no problem. Thanks for having me.
No problem. Jalacy, I'm gonna turn it over to you.
All righty. Thank you again, Ms. Jackson. Next we have Tammy Moore Legates. She is a health profession student with South Carolina AHEC and is currently in our AHEC Scholars Program for social work. So without further ado, I want to turn it over to Ms. Tammy.
Well, good morning. I'm very happy to be here this morning. That was a fabulous presentation, and boy, I hate following that because that sets such a high bar. But as Jalacy said, I am a registered respiratory therapist at the Medical University of South Carolina. As a lot of people don't really know what respiratory therapists do, so I'm always interested whenever I do a talk to see if anybody's ever had any communication with a respiratory therapist for any reason or anything, because like I said, a lot of people have no idea what a respiratory therapist does. They think they hand out nebulizers and give MDIs for patients that have asthma. So I'm always curious, and I can't see the chat, so I don't know the answer to that. But I am a critical care / trauma respiratory therapist, which means that my specialty, much like nursing respiratory has specialties, my specialty is critical care, meaning ICU patients or trauma patients who come through our level 1 trauma center. So those are mainly the patients that I see on a daily basis. A respiratory therapist, my main job is airway protection. If you can't breathe, nothing else matters. So my main concern is when that patient comes in, is that patient breathing? Does that patient need an airway? If they do, I'm the person who places the airway. I'm the person who manages the ventilator. I am the person who assesses that patient for what treatments and modalities of therapy that they need, and to keep that patient functioning or to keep that patient alive. So when you think of a person who is on mechanical support or who is on life support, that's my job, is to run that life support to keep them going. So there are a lot of other things that respiratory therapists do throughout this state. They perform EEGs to analyze brain function, which you kind of think, what does that have to do with cardiopulmonary? This is like your brain, but that's what we do. We do sleep studies. We do training and education. There is opportunity throughout the community for different jobs for respiratory therapists, such as doctor's offices. I have had the opportunity to work in a private practice for, on the side when I'm not doing my real job. And that is the most amazing thing ever, because you really get to know your patients and their families and so forth, and work with them on more of a one-on-one level. Where I work, MUSC, our ICUs do a multidisciplinary rounding. And what that means is, when we come in the mornings, we get our assignments, we assess our patients, we look at their labs, we look at what their x-rays and all of their diagnostics look like, take into account what drugs are on, what drips are running, that kind of thing. And then about between 9 and 10 o'clock in the morning, we all gather together and we start at one particular bed, and it's never bed 1. It never starts at bed 1. You're always going to start at like bed 6. It's like, well, what about the other 5? But the resident will go through and read or tell us about the patient's name, how old they are, what brought them in here, events that have happened up until right now. The nurse will then go and give report on what happened overnight. The respiratory therapist then, and I'm sorry, let me back up just a second. She gives report over what happened overnight and makes recommendations as to what changes need to be made as far as meds, any other therapies that are going on. And we kind of discuss it amongst ourselves, good, bad, or indifferent. The respiratory therapist then gives her report of overnight events, or makes recommendation as to what changes need to be made as far as modality of ventilation, therapies, frequencies. We assess for if the patient is intubated, meaning on life support. We assess, is the patient ready to be weaned from life support? Does that patient need to remain on life support? And we have to have really good reasons as to why we're going to leave that patient on life support. Like, not just because we just don't want to do it today, but there has to be a really good medical reason to leave that patient on life support. So, and then the next person goes, whether it be the pharmacist or the dietitian. There's so many aspects that go into caring for the patient, the PT, OT, everybody has a say. And then at the end, we all kind of chat, like, what did we all get from that? What did we learn? What changes do we feel like needs to be made? Do we feel like we just need to, do they just need like another day to recuperate before we make any changes? And then that's our game plan for the day. We kind of have a game plan per patient, and every patient is different. And then we move on to the next patient, and we go throughout the unit and we do this. And then the remainder of the day, I call it putting out fires. When I love how Adrienne talked about, you kind of have to have your foot in different areas. with respiratory, you're given an assignment, but unfortunately your assignment, if you're given the neuroscience ICU or the neurosurge ICU, that's not your only assignment. You may have the neurosurge ICU and you have those 12 patients who are critically ill. And you also have maybe 9 East and 9 West who are also neurosurge patients that you're going to take care of out on the floor as well. But in addition to that, you're probably going to have the ER as well. So any trauma that comes through, you're going to be pulled from your unit to go to the ER to take care of that trauma patient, depending on the level of acuity of that particular patient. So you kind of have to really be able to take off one hat and put on another, and you have to do it in a split second. It's very important to have really, really good critical thinking skills. As Adrienne said, it's one thing to read a book, but to practice is something totally different. I've been doing this for almost 25 years. I couldn't imagine doing anything else that I love as much as I love getting up at 4 o'clock in the morning, every morning, and driving an hour and a half to work. It is a fabulous career. It is a fabulous life. It is very stressful. It is very adrenaline producing. And I feel like I'm constantly learning something new. I love that we have evolved into where we are using multidisciplinary teams to care for our patients. I remember when I started, the doctor came in, he wrote an order, nurses did what he wrote, respiratory did what he wrote, every other part of the care team did what he wrote, and nobody ever talked to each other. And you would find that what he was writing for, and he's focused on one thing. He's looking at what should be the big picture, but he's not taking into consideration that when your kidneys don't work properly, your lungs and your heart have to pick up that slack. So he's focusing on what's going to help the kidneys, but not thinking about what that's doing to the heart and lungs, and in any of those systems. So with the multidisciplinary teams, everybody kind of has a say, and what your specialty is what you are focused on. And when you're together, you know, the nurse can say, well, you know, the patient needs more fluid, and the respiratory therapist can say, well, his kidneys aren't producing enough urine, so we're fluid overloading him and we're causing him to go into pulmonary edema. And they're like, oh, well, you know, I didn't think about that. I'm just looking at the fact that the kidneys aren't working. That's just an example. So at least with all of us together, we can all have a say in each system working together and see the patient not only individually, but as a whole at the end of the rounding. And I see that really moving forward in maybe some of the smaller community hospitals as well, because we are seeing such success at the bedside and in the units with the patients who are critically ill in our particular hospital. As far as the future of healthcare, telemedicine, it is big. It's going to keep on going, and the more legislature that passes that pays for it, the more it's just going to take off and run. That is another area where respiratory therapists are highly involved. We at Medical University have a pediatric telemedicine respiratory therapy program. It is fabulous. It has really taken off. It's very helpful, especially in rural areas when primary care physicians are caring for children who have reactive airways, and they're just at a loss. Like, what do I do next? I've tried everything. And so they go onto the MUSC telehealth for respiratory, and it, they're able to, actually see the patient, see the physician testing the patient, and then offer their assessment to the physician. So it's worked out very well. I got into respiratory because I was born and raised or I was raised in a very small little rural town in South Carolina, and one of my friends had a genetic disorder. And growing up, the respiratory therapist at MUSC were what kept him alive. And I can remember being a small child and my mom saying, he's probably, he may not be here next year. So just like always concerned about how I was going to react. But I watched these people come into their home every day and care for him. And I had the opportunity to go to Duke when he had his double lung transplant. Now, when he was born, they said he wouldn't live to be 5. At 31, he had done everything he wanted to do, graduated from college, got a job, all the things they said he would never do. And every time somebody would ask him, like, why do you think you're still here? And he would always say, because my respiratory therapist pushed me. And so I went into respiratory therapy because I wanted to have that impact on somebody. And I'm a huge patient advocate. And I hope that one day somebody says, I'm a respiratory therapist because I had that impact on them. So I thank y'all for letting me come and speak to y'all today. And if you have any questions.
Thank you for the information, Tammy. We do have a couple questions. The first question is, can you tell us about one of the most challenging experience you had with a patient?
Yes. My most challenging experience was with a 7-year-old who was who had cancer, and she was the daughter of a dear friend. And this was 20 years ago. She took a turn for the worse, and they put her on life support, and she ended up stroking. And mom called me at home and said, could you please come into work early, because I want you to withdraw life support. I don't want anybody else to do it. And I thought, oh God, I can't do that. But deep down, I didn't want anybody else to do it either. Like, I wanted to be the one. So I did go in early. I did withdraw life support from my friend's 7-year-old child and sat there until she passed with her. And that was probably the most difficult thing I've ever done in my entire life. And I hope that I never have to do that again. But that's where self-care comes in. I knew that was my breaking. I knew that I needed time after that to step back from my job and to go home and hug my child and just be with her, because I knew that my friend was going to go home without her. So it was very difficult, but I made it through, and it was a difficult time, but we made it.
Okay. Thank you so much for sharing, and we appreciate you coming on this evening to speak to our students. Thank you so much.
Great, thank you. I hope y'all have a great day.
Thank you, same to you. All righty, Whitney.
All right, next we have Mrs. Wilcher. She's a clinical laboratory scientist manager at Augusta University.
Hi, can everyone hear me? I'm sorry, I was having some problem with my sound. Okay. Um, so as Whitney said, my name is Keldra Wilcher. I am the core lab manager at Augusta University Medical Center, which is a level 1 trauma center here in Augusta, Georgia. I represent the health profession, clinical laboratory science. It may also be known as medical laboratory science, medical technologists. We have a lot of different names. But we represent a field that is often not heard about because we are behind the scenes. Sometimes we do not get much direct patient care. However, we deal with patients one-on-one sometimes depending on what we're doing, whether it may be doing a bone marrow collection process or collecting tissue samples from patients. But we do represent a field that, like I said, is not often heard of because we don't have direct patient care. Sometimes, even with me, I stumbled across clinical laboratory science myself. It never dawned on me whenever I go to the doctor and I get my blood drawn, I didn't think, well, where are my labs going? I always thought my doctor just came back with the results. I don't know who ran the test. So that's where I feel come in. It's actual people behind putting out those test results. So we represent working with physicians to make diagnosis for patients. We often kind of, laugh and say, hey, without the lab, your doctor is just guessing. So we do play a very, very important part with diagnosing patients. I actually have a small video I would like to show you so you can kind of see what the typical workday is like here at AU Medical Center. So I want to try to share my screen and get this video rolling for you all. All right, can you all see my screen? All right. So this is the grand core laboratory here at Augusta University Medical Center. And my apologies for starting that last part again. So that was just a brief overview of our core laboratory here at Augusta University. So as you notice, our laboratory is fully automated. There's a lot of like robotics and things that you see. So if, when asked the question, where do I see the future of healthcare as far as in clinical laboratory science, because of the shortage in the profession, I do see a lot of more robotics and automation that would be coming, along with telemedicine that I've heard a lot of some of the other panelists say. And so a typical workday in our profession, it basically starts with morning draws. So in the morning, we have collections that are dropped off, let's just say from 4 in the morning to 8 o'clock. That is usually our busiest morning when we're running samples. Then we'll see another busy one during the evening shift, and then we have a busy one during the night shift. And on top of that, along with running those patients, we're also having to do maintenance of our analyzers. So our analyzers are only as good as our results that we report out. So we have to maintain the upkeep of our analyzers as well. And if there are any questions, I'll be willing to take any questions, but I did want to provide you all with just a general overview of what we do here in the laboratory.
The video was fantastic. I'm going to be honest, I just assumed that the doctors poured in like a petri dish or something, and it just kind of figured it out for them. But this was really cool. Thank you for showing that. So I guess a question that we have, I know I get a lot of questions from middle and high schoolers. They typically think doctors and nurses are the only fields that they could go into within healthcare. What encouraged you, and how did you seek out that extra step of, there's more to it than just the doctors and the nurses?
Well, to be honest, like I said, I really didn't know. I actually stumbled across it. I was actually on Facebook one day. I saw where one of my colleagues had graduated from this clinical laboratory science program, and I was like, what is that? So I went looking around, and I was like, oh my goodness, they actually have people that work in the laboratory. Like I said, I thought maybe the nurses were doing the lab work. I did not know that there were actually board certified individuals that actually went to school, did a program, took a certification exam, and they worked in the laboratory. I just did not know that.
Someone else asked, how did you get to the area of testing blood work in healthcare? So I'm guessing they assume, how do you get to where you are now? What type of classes did you have to take? What do you need to be certified in?
Okay, so yes, so you have to have basic coursework in, of course, your mathematics and your biologies as a prerequisite to get into the course. Augusta University Medical Center actually has a program. It's called Clinical Laboratory Science, and it was a 16-month program where you learn about the different fields in medical laboratory science. Once you complete that program, you will have to see it and take a certification exam. The certification exam is about 100 questions. You can do the Generalist Exam, where you will be tested on chemistry, hematology, blood bank, coagulation, or if you have a specific area of interest, hematology, for instance, you can just take that one exam, hematology, and you can be certified in that. So for instance, I have a certification as a generalist, so I can work in any area of the laboratory, but I also have a specialist in hematology. That's the area that I specialize in.
All righty, do you have any tips, any last words you'd like to say to the students?
So my last words would probably just be, when it comes to laboratory medicine, even though you're behind the scenes, you do not have direct contact with patients, our patients still hold a very special part, with us because we're handling their blood samples. We see the results. And so we kind of are at the forefront of, some of those doctors' decisions when, someone may be diagnosed with cancer or sickle cell disease. We see that first and we report it to the physicians. So my last words would be always provide exceptional customer, care to your patients. Even though you're behind the scenes, always provide great care, be exceptional when you provide that care. And I always tell some of my employees, you treat these patient samples the way you would want someone to treat your loved one samples. And so that's why we strive to always put out good results, nothing erroneous. And those are just my last tips that I have.
Someone put in one more question. I'm sorry.
They said, perfectly fine.
They said, what is the salary for someone working in your field?
So it depends on, because you can become a registered medical laboratory technologist, or either you could be a certified medical laboratory technologist. It just depends on the route you decide to take. For a registered, we are looking about starting out at maybe $20 an hour. However, it could get very competitive. So you are looking at us, depending on what you're doing, you can get up to a salary of anywhere to $120,000 a year. And so what you have to keep in mind is you may start off as just a clinical laboratory scientist working the bench doing lab work, but you can also become a manager. You become a supervisor in the field. You can become the director in that profession. So the sky's the limit. You're not just limited to working the bench as a clinical laboratory scientist.
Thank you so much. This is wonderful information, especially if you have those people who don't want to touch patients. This is a great alternative. So again, thank you so much for taking time out of your day to speak with us. And I'm going to turn it to Jalacy for our last presenter.
So we thank you all again. So far, the panel has been awesome. And we're going to finish out our panel this evening with hearing from Edward Singleton, a radiologic technologist. I'm sorry, I struggle with that word so much, but I'm going to turn it over to you.
Good afternoon, guys. I guess you decided to save the best for last. So yes, my name is Edward Singleton, as she's already stated. I'm 25 years old. I've been an X-ray tech for 2.5 years, 3 years, I should say. And I love what I do. I have this presentation that I want to share with you guys. So I'm gonna have to share my screen, so give me a moment. Can you guys hear me clearly? Great. Give me 1 second. All right. So I wish I can hear someone talk back to me. Are you guys able to see this?
Yes, we can.
Perfect, perfect, perfect. So yeah, so just like all the other presenters said, you have nurses, you have RTs, you have lab services. Lab services kind of fall in one, similar to the profession that I'm in, which is the allied health or the ancillary services. And we do have direct and indirect patient care. But I'm a travel X-ray technologist. I'm staffed with a company called AMN Healthcare Club Staffing. And I'm just trying to make sure you guys are seeing this. And this is where the money is, to be totally honest with you guys. Here's a little timeline that I created here. So in 2015, this is where I started at OC Tech. I graduated high school, decided to go to OC Tech. My mom was like, hey, you don't need to accrue all this student loan. So let's think smart about this. So in 2015, I started out at OC Tech and I did patient support services. That's like becoming a quote unquote CNA. I got national certifications encompassing EKG and phlebotomy, and everything a part of healthcare makes a functional care team. EKG, your EKG techs, your phlebotomists, your lab services, your X-ray tech, your nurses, your RTs. everyone is important to a healthcare team. In 2016, this is when I completed all of my prerequisites to get into X-ray school. And during my studies, I met some amazing people. People think just because you're at a technical level that you're not able to engage in extracurricular activities, join clubs, be a part of scholar activities, things of that nature. You're not able to network, go on conferences. But going to OC Tech, really awarded me with these privileges. In 2018, that's when I graduated. I became a staff technologist at Prisma Health Richland in Columbia, South Carolina, where I worked there for about 1.5 years. And that's a trauma center. So in trauma, you learn a lot. You do a lot, you experience a lot, you see a lot. And the other panelists have already spoken on what trauma is all about. So I'm not going to waste my time doing that. And in 2020, up until now, this is where I decided to venture into the travel sector of healthcare, where I decided to travel as an X-ray tech. And I'm a very comical person. I like to joke around. So this is just some things that I put here. It says, under no circumstances should you say to an X-ray tech, oh, it's just a picture. You're only pushing a button. Must be nice. Let me push the button. You're a technician. Taking X-rays is so easy. If you say that, as we see online now, you're gonna end up like this. So this is just some ways that I like to kind of break the ice and be a little bit funny about. But getting to the basic info of what X-ray or travel radiography is all about. What does a travel X-ray technologist do? Well, by definition, and this is something that I Googled, a travel radiologic technologist usually works on a contract or an assignment basis to provide radiology services. Your duties include working with a physician and other healthcare professionals to get an X-ray image to aid in the treatment and diagnosis of a patient. So simply said, to make that in layman terms so everyone will understand, an X-ray tech is someone who utilizes certain equipment. We utilize ionizing radiation to help acquire images of what we can't see with our normal eye. So like the RT said, when they intubate a patient, they put down an endotracheal tube, which is the tube that goes down your throat. They call X-ray. We go in, take a picture of the chest and see the placement of it, make sure that it's right there in the lining of the trachea. Sometimes when nurses place PICC lines or when they place stomach tubes to help decompress a patient, we go in and take confirmation pictures to make sure that the line is in the right area. Because if they push fluids or if they draw any bodily content from an area, you could potentially aspirate a patient or really complicate a patient's care. So we go in sometimes and we get that extra confirmation so the patient is being taken care of. Let's see. As a travel radiographer, what do I do? So sometimes you hear this thing being called allied healthcare, ancillary services. It's all meaning the same thing. You have your nursing profession, your medical profession, and then you have your allied health or your ancillary profession. And that's where I work. That's where lab work, and other services. But like I said, everyone is imperative. But just to read this, it says, as a travel radiographer, you will be helping patients and physicians with X-ray, CT, MRI, sonography. You can work in cardiac, vascular breast, bone, nuclear medicine. Travel radiologic technologists work in areas like hospitals. That's all I've ever worked in. Medical clinics, diagnostic labs, physician offices, acute care, ambulatory surgeon centers. So these are just some of the areas that you can work in as a travel X-ray tech. Let's say travel X-ray tech. Saying radiologic technologist is a bit much. So let's say X-ray tech. So here's some of the pros. You can combine your love of travel with your job, which is a perk. Everyone is traveling now. Everyone is being about self-care, going out, loving themselves, traveling. That's what being a travel healthcare professional is all about. You can see the world in different aspects, and you can also make money and do your job. More job opportunities. Yes, the market is fairly scarce being a staff technologist for X-ray. So you find more job opportunities when you decide to take on a travel gig, earn more money. Yeah, this is the winner right here. So any sort of travel healthcare profession, you're going to make money. You're going to get paid weekly. You're going to make tons of money, a lot of money. Free housing. They give you per diems. They give you stipends to help pay for housing. So you don't have to really worry about that. You may have to worry about the rent back home, but when you're out on your travel assignments, you're living rent free. And I want to share my screen just to show you guys, excuse me, some of the things here. So I get daily recruit orders from travel agencies. This one here at the top is from, let's see, who is this? This is from Vivian. So X-ray techs, as a travel X-ray tech, I literally just got this order this morning at 10:25 a.m. where I can go to San Diego, California, and I'm literally already certified in that state. I can go there and make $4,100 in a week. So yes, being a travel X-ray tech really affords you with making more money. Some of the cons: working in an unfamiliar environment. I don't really think that's a con. To some people it may be, but who don't want to go and explore new opportunities? That's what being a traveler is all about. Seeing different aspects of the world, meeting new people, becoming more cultured. So I don't really think that's a con, but I had to put it there. Changing pay rates only for the better. Like all those rates that you guys probably seen through Vivian Health, which is a search engine that recruiters use to recruit professionals. Those rates are negotiable. You can go high, you can go low, whatever. But who wants to go low? No one. So you always go high. Constantly evolving technology. Yeah. So you have to be very flexible. You have to be very adaptable when you go to these facilities. You have to know how to just like jump in there and work. You have to know what you're doing. You have to have a high skill set in X-ray, super competent. That's what they expect out of you. And it could be lonely. When you make your money, it's never lonely. So, but I had to put that in there, of course. That's one of the cons. And it could be lonely, but I travel back home often. Let's see. Welcome to the future. So how do I see future of healthcare? So I'm hoping for a scientific breakthrough where we all should just join forces and collectively transform the existing health system from treatment-based care to prevention and well-being. Preventive health care for the win. While this has always existed, I feel like, yes, they mentioned the thing about telemedicine, the advances in technology, all that is great. And we know that healthcare and medicine in general, they regulate and accrue a lot of capital. It is one of the highest ways that the government uses to like really accrue money. We know that it's big with the capital, but I feel like preventative healthcare is for the win. We should go in and get our normal screenings. We should go in and get testing when we need to. I feel like that's where healthcare should be. And a lot of the advances that we are making, that money could go towards research in other ways. It could go towards like advances in other ways. And healthcare will always exist because you're always going to have sick people, but there could be a less amount of sick people if we take preventative care really serious. Let's see. So 3 reasons why X-ray is the, you know what? So number one, radiographers is at the heart of modern medicine. Radiography is a fast-growing career with a good salary as a traveler, I should say. And radiography is interesting word, like especially trauma. When you go to trauma, like as an X-ray tech, I would see all kinds of crazy stuff. You would see broken hips. You would see motorcycle accidents where people come, their head is fractured, blood everywhere. So really, as a travel X-ray tech, you have to have level 1 trauma experience. And that makes you most competitive, most marketable when you go into the field. Let's see, period. And these are just some small 1-minute videos that I have here. I'm not going to play them. Why? Because I want to play a different video. This is just me touring my department where I currently work at, and I'll just do like a little slideshow for you guys. Take a look at that.
What X-ray is all about. So this is X-ray. This is one of our fluoroscopy rooms. This is general radiography. These are the things.
This video is about 5 minutes. It's about 4.5 minutes long. Sorry.
One of the bigger machines here. When I was matriculating at OC Tech, this machine was super intimidating, but you get used to it. You do upper and lower GIs. This is where you work directly with the radiologist. That thing on the wall there's called a scoliosis board. We actually take full spine images of the top to lower spine. Usually you deal with pediatric patients for that. This is like the control, the QA room. Here in the cabinet, you will see a lot of our supplies that we do our upper and lower GIs. Here's another fluoroscopy room.
So guys, I don't just want to be completely silent during this presentation here. This is just like one of two suites that we have at the Beaumont Center I work for. I'm currently in Detroit, Michigan. Did I not tell you guys? So I'm in Detroit, Michigan, and I work for Beaumont Health System, which is one of three of the bigger health systems for the state of Michigan. And this is one of the X-ray rooms that we have. That unit that you see on the side there, that is what we call a fluoro tower. And we do all kind of sorts of things under fluoroscopy. Every little thing. We examine the esophagus under fluoroscopy. We examine the upper and lower GI under fluoroscopy. We examine the spine. You can literally X-ray anything. X-rays. We do steroid injections where people come in and they have joint pain or hip pain. We do that under fluoroscopy. And there is a big misconception that I like how the lab girl, I don't mean to call you lab girl, I'm sorry, I don't know your name, but I like how the lab girl says, like, there's a big misconception that nursing and doctors are the only two professions that really make up healthcare, and that is a total lie. I feel like without the services of lab, x-ray, housekeeping, all other ancillary services, we honestly make the doctors look really, really good. All right, so guys, I had to stop sharing that. Something went wrong. I don't know what happened. What is this? Screen bar, go to the application. No, let's get out of that. Okay, so can you hear me? Okay, good. So just to sum it up, why I decided to get an x-ray. I like x-ray. I really do. I always liked patient care. I always was a big avid. I like how that first girl, the nurse, she was like, she wanted to be a doctor. I too wanted to be a medical doctor. And still planned on probably pursuing something at a more clinician level, at a higher clinician level, I should say. But like x-ray really provided me with the opportunity to still deal with patients, not all the time. Like I'm in there 5-10 minutes, even longer sometimes, but it was just so rewarding. And I didn't know that the travel aspect really makes you more financially secure. So, and who don't like money, you know? So that's what's like, it was, and you shouldn't go in healthcare for money. No, don't do that. You should honestly have a passion for it. You should want to do it. You should love patients. You should want to offer the best quality care. All that sounds amazing. And it is. That's why we do it, because we wouldn't do our jobs daily if we didn't have those attributes. But who don't like making money? So travel x-ray really affords you with the opportunity of going out, exploring the world, going to different states, meeting new people. Like, girl, right now I can go all the way to on the west coast of Nevada and hit up some homegirls. Hey, I'm in Nevada this weekend because I've traveled out there. I can go down to Louisiana. I've traveled there. I can come. I'm here in Michigan. If I decide to go back home, I can always come back up here. Travel, healthcare, whether you're doing nursing, whether you're doing x-ray, RT, lab, whatever, it's really rewarding. Questions?
That was amazing. I see one question that wasn't answered in the chat, in the Q&A section. It says, I loved your presentation. How are you able to put it all together?
So Prezi is amazing, honey. That was not me, that's Prezi. Prezi give you a template. You can go and pay like a little subscription fee. And they have so many different features online. It is amazing. But that's all that graphic going in and out of Prezi. I don't have nothing to do with that. I just put some pictures on it, some words, and I'm here to be me, you know?
One more question. What do you have to do to be a travel nurse? Like, what classes do you have to take and steps to get there?
Y'all trying to get slapped like Chris Rock. I'm not a travel nurse. I'm an extra. No, so it's a 2-year program. So I first learned that you can actually get a bachelor's degree when I moved to Louisiana. You can actually get a 4-year bachelor's degree, and technically, you can get a 4-year bachelor's degree in x-ray and or you can get an associate's degree, which is just a 2-year degree. But you still have to go through a prerequisite period. And no one likes the prerequisite period. Everyone hates it. You have to take biologies. You have to take some math courses, some science courses. Everyone hates it, but that's the only way it's going to help build better study habits for you. It's going to show whether you're really competitive and whether you really want it, because you have to pass with a certain grade point average. So yeah, about 2 years, I did x-ray school, very rigorous. Like, you go to clinic, you sit in class, you learn, you go to clinic and you perform.
So I will say that at one point in your presentation, you said that the students, that you were able to do extracurricular activities. And that's big. That's something big that I try to let students know here at Low Country AHEC, because they have to still think about their mental health in medical school.
That's true.
And not get bogged down with, you know, oh, I have to do school, I have to do this, I have to be on point with everything. Like, you're going to have days where you need to have a mental health break. So I love that you mentioned that in your presentation.
Yes, yes. Mental health is really, really, really important. Just as, like I stated in my thing, the future for healthcare, preventive health, mental health, all that stuff is really, really important. And a lot of people think, oh, you're at a technical school, it's only 2 years. You don't even have dorms. You can't even go there. You can't even like go there and like stay and like interact with students that well. But yes, you can engage just as much as you go to a university or for your, you know, college, whatever. They still have the same opportunities, and it's cheaper. So who want to graduate school, having to pay all the student loan, having to pay all that debt? No, you go to technical school, you get, at least if you want to get your basics, your prerequisites. And if you want to advance, you can. But I feel like a start for all graduates, high school, whatever, look into going to technical school first. There's nothing wrong with it. Just because your friends going to the school, going to the dorms, we know they party. You can party too. But
Right.
at a technical basis, I'm telling you, it is so better.
Oh, I thank you so much. I really enjoyed your presentation. Do y'all have any questions for?
Come on, I need more questions.
I will say that Edward was one of our outstanding scholarship recipients many
yeah.
semesters, and always so gracious to lend information and interviews for our magazines and our publicity pieces. And I'm just glad to see you doing so great.
Thank you so much. I appreciate it.
Alrighty. Well, if there's no more questions, I thank you so much for taking time to come on today. And I want to turn everything over to Ms. Paula for our closing remarks.
Okay, great. I would like to thank all of our speakers for giving time today and sharing their knowledge about their professions. Students, this is your time to spread your wings and soar with the information you received. Thank you so much to our partners for collaborating in this effort. We have Marlena from Aiken Tech, Dr. Shukla from Denmark Tech, and Dr. Stephanie Brown from Orangeburg Calhoun Technical College. Jalacy Green and Whitney Green, who are the HCP coordinators for Low Country and Mid-Carolina AHEC. We encourage students to visit the AHEC website to review all of our resources that we provide, and that's at www.scahec.net. We would also like for students to take the evaluation for this symposium. You would go back to the South Carolina AHEC website where you registered for this event, and the evaluation code is B2B22. That's in all caps, B2B22. And I would just like to again acknowledge our champions on the 3 technical colleges campus. If you just wanted to say hello so everyone would see you.
Hello. Thank you, all the presenters. This was great. You can always do it better than we do it in class. And I apologize, my voice is done. I'm a big basketball fan and coach, so you always do it better than we do in class. So we thank you for giving all that you have and pouring into our students. Thank you so much.
Thank you all for joining us. This was a great session. Special thank you to Edward. And I hope you all learned a lot. And if you have any questions, just feel free to reach out to us or our partners at South Carolina AHEC.